Hi there, I'm Dr. Megan Fortin, and I'm here to talk to you a little bit more about some of the SIBO testing options and complementary testing that you can consider when trying to work up your gastrointestinal health. And this often I'm going to dive more into this in our SIBO course as well. So first off, I would suggest considering a 3-hour lactulose breath test to further identify if you actually have SIBO, and if so, what type you have. So if you're not getting this through an existing provider, your own gastroenterologist, through us if you're a patient of ours, or through anyone else overseeing your care, then you can consider doing one of the at-home tests that you can order for yourself, including through possibly a lab like Genova Diagnostics. And I would suggest making sure that you're choosing the 3-hour test option as opposed to their 2-hour test option, and making sure that you're doing it with lactulose. Another SIBO breath test you can consider is called a Trio Smart breath test by Gemelli Biotech. This test looks at the third type of SIBO called hydrogen sulfide SIBO. So if that's something that you're suspicious about, or you have the suggestion of hydrogen sulfide based on a flatline two gas breath test that I talk about in the course, then it may be worth the confirmation with the Trio Smart test. And then other things that may be worth considering include something like the IBS Smart Test, which is especially appropriate if you have any SIBO symptoms that started, or IBS-like symptoms that started after having food poisoning, traveler's diarrhea, or a stomach flu, especially if you're prone to more IBS-D-like symptoms with diarrhea. And then it may be further worth considering testing after the fact with microbiome tests like a GI map or a GIFX stool test, which I don't go into too much of the ins and outs of how to treat that in this course. We'll save that for another course, but all things worth considering, and to make sure we are getting the objective data behind your treatment. Thanks so much for listening.